In this video, we're going to discuss the difference between passive insufficiency and joint tightness. Both passive insufficiency and joint tightness will limit passive range of motion of a joint, but they do it in very different ways, and of course, therefore, your treatment for each of these is going to be very different. So it's important that you know how to distinguish between the two. Passive insufficiency is when a muscle tendon unit that crosses two or more joints doesn't have enough length, enough excursion to allow all of those joints to extend at the same time. In this case, we're going to look at the long head of the biceps as an example of a muscle tendon unit that crosses two joints and could exhibit passive insufficiency. The long head of the biceps has its proximal attachment on the superior aspect of the labrum, then travels through over the head of the humerus through the bicipital groove between the greater and lesser tubercles, and has its distal attachment on the radius. In this example here, our biceps muscle tendon unit, represented by this purple cord, with the shoulder joint in about 0 degrees of flexion extension, doesn't have enough length to allow the elbow to extend into full extension. We have about a 60-degree flexion contracture of the elbow at this point. So when your patient comes with this, your first thought should be, well, is that a joint tightness or is that a muscle tendon unit passive insufficiency problem? In this case, where we have this passive insufficiency problem, it's the muscle tendon unit that's too short to allow the shoulder and the elbow to extend at the same time. In fact, if we take the glenohumeral joint and bring it into full extension, you'll see that the passive insufficiency actually gets worse. And now we have about a 90-degree contracture at the elbow joint. However, if we take the shoulder joint and bring it into, let's say, 90 degrees of flexion, now we have enough length in that long head of the biceps to allow full elbow extension. By flexing the glenohumeral joint, we decrease the amount of distance that long head of the biceps has to travel at the shoulder, allowing more length in that muscle tendon unit to allow for full extension of the elbow. If we bring the shoulder back down into a neutral position, we're right back where we started, with about a 60-degree or so flexion contracture at the elbow. So if it's a passive insufficiency problem that doesn't allow full passive range of motion of a joint, muscle tendon units that cross that joint and cross another joint need to be assessed for. And the way you do that is change the position of joints either proximal to or distal to the joint that you're looking at, and see, does that change the amount of range that I can get at my joint? If it does, you have a passive insufficiency problem due to muscle tendon unit tightness, where that muscle tendon unit crosses two or more joints. Now, contrast that to joint tightness. By joint tightness, we simply mean the joint capsule or the ligaments around the joint. Those structures are tight. If I were to say have an anterior capsule tightness, indicated by my index finger here, anterior capsule tightness at the elbow joint, it wouldn't allow for full extension of the elbow. It would allow for full flexion of the elbow, of course, because the anterior capsule then just bunches up. But then when you try to extend the elbow, that anterior capsule, if it's too short, too tight, will limit full extension or full passive range of motion into extension. This problem here with the anterior capsule of the elbow joint obviously is not going to be altered in any way by movement at the shoulder or at the wrist, for that matter. So, when you're looking at passive range of motion limitations, and you're wondering whether it's passive insufficiency or whether it's joint tightness, the way to distinguish the two is passive insufficiency. If that's the problem, the limitation and passive range of motion at the joint you're looking at will be changed in some way by changing the position of the joints either proximal or distal to the joint you are looking at, depending on whether the muscle tendon units cross the joint you're looking at and a proximal joint or the joint you're looking at and a distal joint. Joint tightness, on the other hand, will not be altered by changes in position of joints proximal or distal to the joint that you are looking at that has a passive range of motion restriction.